Over the next 3 videos, we're going to be sharing with you the 3 most common mistakes that practitioners make when launching a functional medicine program. So if you are someone that has been considering adding functional medicine, hopefully this is incredibly valuable for you so you can avoid these mistakes altogether. We've worked with thousands of practitioners and have personally coached over 300 clinics across the country, so we can say with a high degree of confidence and certainty that we know what we're talking about. So, mistake number 1 that we see is a failure to understand what a patient truly wants. And nowhere is this more reflected in the way in which practitioners go about pricing their functional medicine program. So their pricing model itself. The most common model that we see in terms of pricing when a practitioner launches a functional medicine program is they base it around their time, around their tests, around their supplements, and around their tools. And so obviously, their time, a practitioner will allocate an hourly rate, and they'll say, okay, when a patient comes in for a 30-minute block of time or an hour block of time, we're going to charge X amount. And for labs, our labs are costing us X amount, and so we're going to increase that. So we're going to have a margin there. So when we run X number of labs, a patient is going to pay me for those labs. I'm going to make a margin on those. Supplements cost me X amount, so we're going to increase and we're going to have margin there, and whatever tools that we're using as well. And so that's probably the most common model that we have seen in terms of the pricing. The problem again with this model is that it is incongruent with and it fails to take into consideration what a patient actually truly wants. You see, patients actually don't want your time. They actually don't want the tests. They actually don't want the supplements. They actually don't want any of the tools. At the end of the day, what a patient wants is a solution. If it so happens to be that that's the way to get the solution, then again, so be it. But the problem is that when you're focused on your time and your tools and your tests and your supplements and all those things, you're focused on the features of the program and you're not focused on what the patient actually values. You see, what a patient actually values is the solution itself. And I would add one more element to that. A solution in the highest probability of achieving said solution in the fastest and most convenient way possible. And so the way that we solve this problem is we go about engineering or creating a program that is focused on the solution itself. When we present our programs inside of Simplified Functional Medicine to prospective patients, our programs are designed in such a way that they increase the likelihood, the perceived likelihood to the patient that they will achieve the result that they're after, that they will get the solution that they're after, and they're designed in such a way to make it as convenient, as simple, and as easy for the patient as possible. Because again, patients, they don't place their value in an hour-long consultation with some genius. They don't place value in running dozens of complex lab tests. They don't place value in garbage bags full of supplements. What patients truly value is the solution itself. And again, a path to that solution in the most convenient, simple, and easy way possible. And so that's the distinct difference in the way that we price our programs. Is our programs are priced in such a way that we truly and fundamentally understand what the patient truly values and what the patient truly wants. We've designed these programs in such a way that they're ready to go to plug right into your practice so that you can provide these solutions to patients, and patients will more likely and more readily pay for that solution because, again, it factors in and takes into consideration first and foremost what they actually want. So hopefully that makes sense because, again, this might seem like a simple one, but this is probably one of the biggest, if not the single biggest mistake, is when you go about charging for your time, when you charge for your tests, when you charge for your supplements. Number one, you're focused on the features and not on the solution to the patient. And number two, the other problem with that too is you become to a certain degree a commodity, right? Patients will price shop supplements, they'll price shop lab tests, they'll price shop all these different elements because, again, what you've provided them isn't necessarily a solution per se. It's a series of different steps towards the solution. What we provide them inside of Simplified Functional Medicine is a convenient, simple, easy to understand, and easy to implement solution. It's focused on the solution itself. And so hopefully that makes sense. So if you're crafting a program yourself, make sure that it's focused on the end result, that it's focused on the likelihood of achieving that solution for the patient so that they really get it. The patient understands that you're focused on them and their goals and the solution that they're after. That's what patients value. That's what patients will pay for, is the likelihood to achieving their goals and getting the solution that they're after. So hopefully that helps. On the next video, we're going to be talking about the second mistake, and that second mistake is failure to launch. So look for that next video. We're going to be sharing with you real soon.